Welcome back to Good Things Utah. If you were born between the years of 1945 and 1965, there is something that you should be tested for. What is it? Dr. Gordon Harmston is joining us now from Utah Gastroenterology. What test do those people need?
That's hepatitis C, and you know, we've known about hepatitis C now for about 20 years. Hepatitis C is a virus that people catch from bloodborne contact, and a lot of people caught this virus decades ago. It can,
from what? How could they get that?
You can get hepatitis C from any kind of blood-to-blood contact. So a lot of people before 1992 could have gotten it from a blood transfusion they had. Our donor blood wasn't tested for hepatitis C until 1992. Also, a lot of people from using IV drugs, you know, back in the day, somebody may have tried IV drugs one time, and that's enough to get hepatitis C. So because of the way hepatitis C works, patients have no idea they have it. It can last for many decades in the blood before they start to have symptoms.
So you wouldn't feel sick? You
wouldn't feel sick at all. You'd feel fine, yet you have this disease that eventually in your life is going to cause big problems.
So why those years? Why between 1945 and 1965 so important for them to get tested?
I think it's a demographic issue, in that those are patients that were at the age where they might have gotten a blood transfusion that was had contaminated blood, and also there was just more experimental drug use in that population during the late 60s, early 70s, of course. So.
Even improper tattooing?
Yes, improper tattooing, especially self-tattooing. You think if you're doing your own tattooing with a needle and some ink, and you're doing that with a needle that your friend is using and they have hepatitis C, well, you've just given yourself hepatitis C.
How does it eventually affect your overall health? What happens to the body?
What hepatitis C does is the virus lives in your body for decades and causes a slow, low-grade inflammation in liver, hepatitis. And over time, that inflammation in liver leads to scarring, which then leads to cirrhosis of the liver. And once a patient has cirrhosis, they can develop liver failure, they can develop liver cancer, and it's a leading cause for liver transplant now in the United States.
Doctor, are we looking at like a healthy liver right there in the picture?
Actually, none of those are healthy livers.
None of
so
it.
These graphics show on the left the chronic hepatitis. So this is the virus causing a chronic inflammation of the liver, and over many, many years that leads to the scarring of the liver, which is shown in the center of the picture there. And then on the right of the picture, patients with cirrhosis and hepatitis C are prone to develop liver cancer. So that shows a tumor in the liver on the right.
So why have people not been getting tested?
Well, a lot of people certainly know they have hepatitis C and have been getting tested, but in the treatment to this point has been difficult, because all the treatment that we currently have is with a medication called interferon, and interferon is a very harsh medication with severe side effects, and it doesn't even work that well. It only works about anywhere from 50 to 70%, kind of depending on what combination you're using it in. And so a lot of patients that know they have hepatitis C are aware of that, and so they've kind of avoided treatment. What's promising now is that we have new therapies that are emerging, and we've seen phase 3 trials now with pills that you can take instead of these interferon injections, and the combination of these pills is having great efficacy and also much less side effects for patients. So it's very promising that this is going to be a curable disease, where in the past I think people were like, you know, it's going to be very difficult to get treated, and it's probably not going to work anyway, so I don't want to know if I have it, even though I'm at risk, or even though I have it, I'm not interested in treatment. So,
but actually, if you look at that liver in the picture of the liver, what can happen to you if you're not getting it treated? Severe health issues. Yeah,
severe. And you know, any medical provider will tell you there's nobody sicker than a liver failure patient, and it's a real epidemic in our country right now, where liver transplant lists are longer. You know, there's more patients with liver failure all the time, and you know, if we can get in front of the problem by identifying all the high-risk people and that high-risk age of population, get all of them treated with these new therapies, it's going to be a real benefit for all these patients and for our healthcare system in the future.
Is it easy to get screened?
It's easy. It's just a simple blood test, and it's a simple blood test. If the blood test is positive, then you'd need more confirmatory testing if the screening test was positive. But yeah, it's simple, and this is something that the Center for Disease Control is pushing, and so your primary care providers if you're in that age group, should be testing you. But if we help raise that awareness with patients, then hopefully that testing rate will go up.
Well, and you can also contact Utah Gastroenterology to do testing and to ask more questions. They have 6 different Utah locations in Bountiful, in Murray, in Riverton. They're at St. Mark's, Old Mill, St. George. We have that list right there on your screen. They also have a phone number. You can call for an appointment. That's the website. The phone number's there too. Go to abc4.com/dailydish and we will put all that information right there. But I love hearing new treatment options.
Yep, it's wonderful. Great new research and great new treatment.
Thank you. Sorry, by the way, /Good Things Utah.
Yeah, thanks.
Go to our website.